Benign prostatic hyperplasia is a condition where the prostate, a walnut-sized body part made of glandular and muscular tissue, grows in size. The prostate surrounds part of the urethra, which is the tube that carries urine and sperm out of the body. Benign prostatic hyperplasia, or sometimes hypertrophy, is an enlarged prostate gland, and it's not typically a serious problem, nor is it life-threatening. To clear up a common misconception, benign prostate hyperplasia is not cancer, nor does it cause prostate cancer. The condition is associated with older men. The following herbs help to relieve the irritation that's associated with the benign prostatic hyperplasia. Androgenic hormones have been known to play an important role in the development of the benign prostatic hyperplasia, and they've been a target in its medical treatment. Estrogens have also been implicated in the benign prostatic hyperplasia, but in contrast to androgens, the function of the estrogens in the prostate is still obscure. The effect of estrogens in the prostate can be mediated by estrogen receptors alpha and beta. These two receptors have different expression and function in the prostate, thereby presenting a window of opportunity to selectively target them for the therapeutic purposes in the benign prostatic hyperplasia treatment. The action of the estrogen, as mediated by estrogen receptors, appears to contribute to the development of the benign prostatic hyperplasia in men through an intricate molecular process. Increasing the intake of vitamin D from the diet and from supplements has shown a correlation with a decreased benign prostatic hyperplasia prevalence. Vitamin D analogues of up to 6,000 international units per day have shown to decrease the prostate volume in these patients. Be sure to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency that you might have. Vitamin D2 works synergistically with vitamin D3. It was also labelled Activator X by Dr. Weston Price, and he found that it reduced the risk of many diseases and was linked to extended lifespan. Intervention studies with vitamin K2 brought down the levels of DP, UC, MGP, and it also led to relief of some of the disease endpoints. The process of varicose vein formation includes a role for vitamin K, implicating a lack of vitamin K in the development of varicose, which can lead to benign prostate hyperplasia. Take vitamin K2 in the form of NK7 in a dose range from 100 to 300 micrograms per day. Coenzyme Q10 was shown to significantly reduce the serum prostate serum antigen level. You can take coenzyme Q10 in the form of ubiquinol in doses from 200 to 400 milligrams per day. Resveratrol is the anti-aging compound found in tiny amounts in red wine and in the herb Japanese knotweed. Resveratrol is reported to inhibit the growth of the prostate, which is characteristic of the benign prostatic hyperplasia. Resveratrol treatment inhibited the growth of BPH1 and it induced apoptosis of cells. Typical doses are 500 to 1000 milligrams per day in the form of trans resveratrol. Curcumin found in turmeric root can significantly lower prostate weight and prostate volume, and curcumin treatment decreased the expression of VEGF, TGF-beta1, and IGF-1 among the growth factors in the prostate tissue. These findings suggest that curcumin inhibited the development of benign prostatic hyperplasia, and it might be a useful herbal treatment. Typical doses are from 1000 to 5000 milligrams per day. Due to its poor bioavailability, it should be consumed with biopterin, which is a black pepper extract, or taken with an oil like fish oil, butter, ghee, or coconut oil. Results suggest vitamin C inhibits testosterone-induced HIF-1-alpha expression, and by doing so, it effectively prevents prostatic hyperplasia. You can check out my video on how to make liposomal vitamin C at home. This method can also be used to enhance the bioavailability of some of the other supplements mentioned like curcumin and resveratrol. Zinc is required by the body for around 100 different enzymatic processes. More than 16 studies have reported that zinc is markedly decreased around 60 to 80% in prostate cancer compared to normal and benign prostate tissue, and no study has reported prostate cancer without a decrease in zinc levels so far. The consequence of only a mild zinc deficiency, such as impaired immune system function, is especially relevant to the maintenance of health, and it may be critical in the prevention of age-related diseases, especially in the prostate, where adequate zinc status can help to maintain the health and the physiological function and prevent the prostate disease from developing or further progressing, thereby acting as a vital anti-benign prostatic hyperplasia agent. Zinc has a low bioavailability, and like vitamin C, its absorption can be increased when it's taken with quercetin, the bioflavonoid that's found in grapefruit peel or in elderberry. It can also be taken as a supplement in doses from 500 to 1000 milligrams per day of quercetin. According to the results of a study, it seems that the quercetin has better effects on reducing the benign prostatic hyperplasia symptoms, and it increases urine flow rates when compared to a placebo. Increasing epidemiological evidence suggests that diabetes significantly increases the risk of benign prostatic hyperplasia. You can check out my videos on diabetes type 1 and type 2 for herbal and nutritional information to help to treat these conditions naturally. The role of inflammation in benign prostatic hyperplasia development was highlighted by the strong correlation between histological inflammation, IPSS, and prostate volume. Prostate enlargement due to chronic inflammation processes can progressively produce the benign prostatic hyperplasia. Therefore, inflammation is a therapeutic target. You can check out my video on inflammation and on antioxidants for some helpful tips here. Immune cells infiltrate the gland and induce prostate lesions. The genetic background and hormonal imbalance are factors that can contribute to the onset of the disease in susceptible young males. Moreover, spontaneous autoimmune prostatitis can also occur with advanced age in susceptible strains. You can check out my video on treating autoimmune conditions with diet and lifestyle changes for ways that could help here. Oxidative DNA damage is likely to play an important role in prostate hyperplasia, as depicted by decreased activity of the free radical scavenging enzymes and the glutathione levels. This might have enhanced DNA damage, leading to the benign prostate hyperplasia. You can check out my video on the body's master antioxidant glutathione to learn about its importance in maintaining your health. The demand for complementary and alternative therapies includes an interest in the use of phytotherapy, and it's increased in recent years. This is especially important as some of the medications currently in use for the treatment of the benign prostate hyperplasia have undesirable adverse effects. Phytoestrogens, which are naturally occurring compounds from plants, mimic estrogen, and they've known to be used in the treatment and the prevention of the benign prostatic hyperplasia. The major class of the phytoestrogens includes isoflavones, lignones, and cumistans. Isoflavones are perhaps the most researched class of the phytoestrogens. They're polyphenolic compounds which are naturally found conjugated to sugar molecules as biologically inactive glycosides. Upon the breakdown of isoflavone glycoside conjugates, the sugar molecules are released, resulting in biologically active isoflavone aglycones, such as genistin and dydsin. Isoflavones are most abundant in legumes, like soybeans, as well as in grains, nuts, wine, and berries. Lignans are constituents of plant cell walls, and they're found in many fiber-rich food and fruit, like wheat, barley, rice, linseed, cherries, apples, pears, and garlic. Cumistans are phenolic phytoestrogens, with cumisterol being the major constituent in the group. The cumistans are known for a variety of biological activities, and they can be found in alfalfa, clover, and sprouts of beans. The composition of plants like soy, red clover, African plum tree, pumpkin seed, and saw palmetto for the health benefits, particularly in ameliorating the symptoms of benign prostatic hyperplasia, is well documented. Several experimental animal studies have shown the benefits of phytoestrogens in the treatment of the prostate. The possible mechanism of action of the phytoestrogens may be related to their structural similarity to estrogen and their ability to act as a weak agonist or antagonist of the estrogen. They could also act as anti-androgens by competing for androgen receptors and by regulating the activity of 17-hydroxysteroid dehydrogenase, the enzyme that's involved in the metabolism of testosterone. Clinical management of benign prostatic hyperplasia with saw palmetto is very popular, though saw palmetto extract has been shown to be beneficial in the treatment of LUTS that's associated with benign prostatic hyperplasia. The outcome of clinical trials has not convincingly proved its efficacy compared to placebo. Perhaps this is due to different formulations of the saw palmetto extract that was used in the studies, and inherent flaws in the research design of some of the studies. Hence, it would be necessary to conduct vigorous research on the clinical trials to prove the effectiveness or otherwise of the saw palmetto in the treatment of the benign prostatic hyperplasia. Meanwhile, the current status of the saw palmetto extract in the treatment of the prostate is that it's safe and it could be effective, particularly in improving nocturia and other self-reported symptoms. Saw palmetto berries, a semi-fresh tincture at a 1:3 dilution, taken at 20 to 30 drops every 3 to 4 hours for the prostate enlargement and irritation and difficulty with urination is what's recommended. Black mulberry extract has protective effects against experimentally induced benign prostatic hyperplasia in rats with regard to histopathological and biochemical parameters, which could be related to its antioxidant as well as its DHT reducing properties in the prostatic tissue. Alfalfa leaf as 1 teaspoon of the herb with 8 ounces of hot water steeped for 45 minutes, taken twice a day, can relieve prostatic irritation. Black willow or Salix nigra, fresh tincture at a 1:2 dilution, 10 to 20 drops every 3 hours for an acute inflammation of the prostate with pain accompanying erection or ejaculation is recommended. Corn silk, a fresh tincture at a 1:2 dilution, 20 to 40 drops, repeated frequently for the prostatic irritation with inflammation of the vas deferens or the spermatic cord and a burning sensation when urinating is recommended. A gravel root tincture, a 1:5 dilution, 10 to 15 drops in water every 2 hours for an enlarged prostate with feelings of heat, difficulty urinating, cloudy urine, and containing mucus is recommended. One of the most common complaints of men who sleep poorly is they have an urge or need to use the restroom many times during the night. This can lead to sleep fragmentation and excessive daytime sleepiness. Most often the cause is an enlarged prostate, also known as the benign prostatic hyperplasia. You could check out my videos on herbs to help you sleep for more information about this, or my video on melatonin. One example is melatonin helped benign prostatic hyperplasia patients with nocturia by reducing the habitual midnight awakenings. Stress can worsen the symptoms of benign prostatic hyperplasia or the enlarged prostate. You could check out my videos on herbs for stress, on nervines, on various mental health conditions, on the different neurotransmitters, and on the MTHFR polymorphism and its link to the cortisol stress hormone, and ways to help to address this with supplements and diet and exercise. Also research the pregnenolone steal to see how stress can raise inflammation through the increased cortisol, while at the same time interfering with your body's natural production of testosterone, estrogen, and DHEA. For more information about herbs, supplements, and natural treatment methods, check out my website.